So we have looked at all the bad sides of pelvic inflammatory disease. We have painted a bad name to pelvic inflammatory disease. So right now we want to actually paint a diplomatic approach to pelvic inflammatory disease, trying to talk about the possible treatment options for pelvic inflammatory disease. So what we got here is treatments for pelvic inflammatory disease. So for pelvic inflammatory disease, of course, we said that it's an ascending infection. So from the lower genital tract, it ascends up to the upper genital tract, and it causes inflammation in the uterus, in the fallopian tube, in the ovaries. So what's the possible treatment modalities for this? So first of all, as a way of introduction, you should know that it's treated with broad spectrum antibiotics, and your partner should also be managed alongside. Okay, sometimes hospitalization or surgery, okay, if any complication comes in. Complications like what? Tubo-ovarian abscess. So for mild to moderate pelvic inflammatory disease, most patients can be treated outside the hospital. That's outpatient treatment. Okay, so Ceftriaxone is usually given intramuscularly. Doxycycline is usually given 100 milligrams orally twice daily for 14 days. They can add Metronidazole 500 milligrams twice daily for 14 days. Okay, so the regimen will cover pelvic inflammatory disease caused by Neisseria, gonorrhoeae, Chlamydia, trachomatis, and any anaerobic bacteria. Okay, so inpatient treatment, that's if hospitalization is required, there's severe illness, right? The person is having pelvic inflammatory disease alongside high fever, vomiting, and there's peritonitis. So maybe the person has pelvic inflammatory disease and the person is pregnant, so you have to hospitalize such a person to follow up. So the person has pelvic inflammatory disease and it has developed into an abscess. Okay, so you give what? Intravenous antibiotics, because it's an emergency now, so everything is intravenous. So Cefoxitin or Cefoxitin, you add it plus doxycycline. Okay, you can give it orally or intravenous. It's a Clindamycin plus Gentamicin that it must be intravenous or intramuscularly. Alright, so sexual partners within the last 60 days should be treated. So you ask the person, whoever they have had sex with in the last 2 months, the person needs to receive treatments too, okay, for those microorganisms. And the person has to actually what? The person undergoing pelvic inflammatory disease should abstain from any sexual activity until the treatment is completed. Okay, so that's it.